Hello everyone and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer, the information provided in this program is to assist you in exploring all available options to empower you to make well-informed decisions, to help you feel in control, be responsible for and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is also not intended to replace professional or medical or other kinds of advice. Now in this recording, the last in the breastfeeding class series, we will be looking at milk storage guidelines, and I have highlighted it for you on the list of topics that we are covering in this breastfeeding class series. Now, milk or human milk is a living biological substance. It is full of good bacteria and probiotics, and it should be handled appropriately. Now, if you want to know what else is in human milk, this human milk infographic represents the known components of human milk, and you can see more at human/milk.com. So just a few notes that I want to share. First off is always wash your hands prior to handling milk. And when you store milk, expect that the milk will separate. The cream usually rises to the top of the milk and it looks thicker and whiter. So before feeding, just gently swirl the container of milk in a gentle tornado-like fashion to mix the cream back through again, rather than shaking it, because remember, it's alive. Now, milk expressed can be pooled for 24 hours or a 24-hour period. So if the amounts of milk expressed are small, you can keep on adding to the same container throughout the day. Now, personally, I would just cool the freshly expressed milk first before adding it to the already cold milk. And then another point I want to make is sterilize all equipment for expressing and storing milk. And hard-sided containers such as hard plastic or glass are the preferred containers for long-term human milk storage. Now, these containers should also have an airtight seal and not be made with the controversial chemical bisphenol A or BPA. And then the use of plastic bags is not really recommended for long-term storage, because they can spill or leak and become contaminated more easily than hard-sided containers. And the milk components can adhere to the soft plastic and be, lost when the milk is transferred to a feeding device. Okay, so how? As a general rule, frozen milk is for emergency stashes. So if you plan to have an emergency stash, you could express a few minutes before, between or after breastfeeding in a sterile container, and then cool the milk down in the fridge. And when you have the amount needed for feed, you can freeze it. So I would suggest freezing the milk in an ice cube tray. It's very convenient because you have measured volumes, which can easily be placed in a container for defrosting. So fill an ice cube tray amount about 3/4 way with a measured amount of fluid, say 20 or 30 mils, or how much ever the cube will take to be filled, only 3/4 way. And we say 3/4 way because the milk expands during freezing. Anyway, mark the level with a permanent marker, and then fill it to that level with the expressed breast milk, and cover the container and place it in the freezer for a day or two. And once the milk is frozen, you can store the milk cubes in a freezer bag, or then you just need to double bag it, or just a hard plastic container, and just note the date of expressing. And use a small container, just big enough for the milk cubes of one 24-hour period. If you use, for example, 4 days worth of cubes in one container, then you need it needs to be the oldest date. So maybe just pull one 24-hour period in one container. Okay, so how long can I store the milk for? So breast milk can be stored at room temperature for about a room temperature of 16 to 29 degrees for 4 hours optimal. Those 6 to 8 hours is acceptable under very, very clean conditions. And breast milk can be stored in an insulated cooler bag for 24 hours. Just try and keep the ice pack in constant contact with the milk containers and limit opening the cooler bag. Breast milk can be kept in a refrigerator at 4 degrees for 4 days optimal, 5 to 8 days under very clean conditions. And breast milk can be stored in a chest freezer for up to 6 months, though 12 months is considered acceptable. And if you don't have a chest freezer, then about 3 months in a freezer with a separate door, and only about 2 weeks if you have one of those freezer compartments inside your refrigerator. Now, you can store milk in a chest freezer for longer because the cold descends and it's not affected as much by opening the freezer as much as a door freezer would affect the milk. The American Academy of Pediatrics say that after 4 hours breast milk after 4 hours at room temperature or 4 days in the refrigerator should be frozen. Now, when you need to use your frozen milk, or if you need to defrost the milk, you can thaw the human milk by placing it in the refrigerator the night before. So it takes about 12 hours. If you need to defrost it quicker, the container can be run under water from the tap. So just start cool and then gradually increase the temperature or just reheat it in a bowl of warm water. And then milk may be kept in the refrigerator for up to 24 hours after it's thawed. So when warming breast milk, keep in mind that it comes from body temperature, so rather not heat it above body temperature. Research shows that concentrations and activities of immune proteins and bioactive enzymes, etc., their activities decrease when the milk is heated above 50 degrees. So let's say warm the milk to a max of 40 degrees. And please don't use a microwave to warm breast milk. Although microwaving milk decreases bacteria in the milk, much like pasteurization does, microwaving also significantly decreases the anti-infective qualities of human milk, that living immune cells that fight disease, which is going to reduce its overall health properties for the baby. And also microwaving can cause hot spots that can burn the baby's mouth. Now, once frozen milk is brought to room temperature, its ability to inhibit bacterial growth is lessened. So the duration of time the milk can be kept at room temperature once the baby has partially fed from the cup or bottle would in theory depend on the initial bacterial load in the milk and how long the milk has been thawed and also the surrounding temperature. So based on relative evidence thus far, it seems reasonable to discard the remaining milk within 1 or 2 hours after the baby is finished feeding. And if you want to test if the milk is spoiled, do what we do with the milk you put in your coffee. Just smell it and taste it. So talking about smell, refrigerated and frozen milk have an odor different from fresh milk or freshly expressed breast milk due to the fat breakdown, which actually starts as soon as the milk leaves the breast. And that really releases fatty acids. Now, breast milk comes with many enzymes, and one of these are lipase that breaks down milk fat, which is amazing. Anyway, this might cause the milk to have a soapy smell. So a sour or rancid odor likely comes from oxidation of these fatty acids, and it becomes more intense with longer storage. So there are a lot of misinformation about this process, as information of high lipase continues to circulate in social media. And these changes in taste is normal, and the vast majority of babies don't refuse the altered taste of previously expressed milk. And we eat smelly things too and enjoy them. The Academy of Breastfeeding Medicine say heating milk above 40 degrees to deactivate the lipase is not advised, and also because it may destroy many of the immunological factors in human milk. Now, if the milk smells sour and the baby rejects it, a mother can try storing her milk for the shortest time possible, and also avoid exposing the milk to light during storage. And if a mother has frozen milk and her baby refuses it, she can try defrosting her milk in the refrigerator rather than warm water or at room temperature. And some other things that might help is the mother can maybe decrease her intake of polyunsaturated fatty acids, such as canola oil or fish oil or grapeseed oil or flaxseed oil or things like that. And maybe drink bottled water rather than tap water where possible, maybe to try and avoid possible oxidants such as copper and iron in the water. And also strive for a diet rich in antioxidants such as berries and nuts and dark green vegetables and sweet potatoes and fish, etc. And also, one can consider donating frozen milk to a milk bank because lipase and other taste issues are not a problem for milk banks. Now, still on the topic of funny milk, have you ever seen a mother's milk turn pink after expressing? Now, one possible reason could be because the milk turns pink, is it could be blood. So sometimes a small rupture in blood vessels in the nipple or the breast may turn the milk pink. Apparently, a small amount of human blood in milk is not a problem for a breastfeeding baby. Just the smallest drop of blood can noticeably stain the milk quite pink. And if the milk was colored pink due to blood, the blood is heavy and it will settle at the bottom of the container, and then parents can transfer the clear milk into another container and feed that to the baby. But please see a lactation consultant for breastfeeding or maybe milk expressing assessment if that was the cause of the bleeding nipple. And another reason milk may turn pink is due to a bacterium called Serratia marcescens. This is a very common everyday opportunistic bacterium which is usually harmless, and this bacterium is responsible for that pink or red rings you see around the sink drains in households worldwide. And this red pigment is called prodigiosin and produced at temperatures below 37 degrees. Now, Serratia marcescens has been reported to colonize human milk, where at room temperature it produces this reddish pink pigment that turns human milk and poo diapers pink. And the discoloration is commonly seen in bottles and towels and pumps left overnight with milk residue in them. So it's unlikely that a baby feeding directly from the mother's breast will consume enough bacteria to cause disease. However, improper handling of human milk may allow the bacteria to multiply to numbers capable of producing disease. So refrigeration of human milk and breastfeeding equipment is usually sufficient to prevent Serratia from multiplying and generating this pink pigment. And sterilize all breastfeeding equipment that has come in contact with Serratia discovered milk and replace any equipment that cannot be properly sterilized. But to ensure the safety for mum and baby, a mother should see a doctor immediately if she has discolored milk and or notice her freshly expressed milk turns pink, just to make sure that the baby is okay and doesn't have an infection. And also, please never feed your baby any pink or red colored milk until it's cleared by the doctor. And then something else, lastly, I hope you're not eating at the moment. Have you ever seen stringy milk like this? Now, this fatty or fibrous looking material can sometimes be seen in milk, and it may look like milk clumps. And this is of a mother with mastitis. So please see a doctor to rule out mastitis if you notice anything like this while expressing. And on that note, thank you for watching this recording, this last recording in this breastfeeding class series. I will be adding a lot more tidbit topics in future, and you are most welcome to let me know in the comments below which topic you would like me to cover. And please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. Please feel free to subscribe to this channel for more breastfeeding class recordings and tidbit recordings. And take care till next time.